So I think questions actually come in same ways, okay? And if they ask you why, when they ask you why, they're just trying to test your knowledge of that whole area, okay? So like for this now, they said that why will someone that has a lesion of the tibial part of the sciatic nerve still maintain some active flexion at the knee joint? There are two things they are trying to test out for here. They are trying to know if you know the muscle that the tibial part of the sciatic nerve supplies. Then they are also trying to test your knowledge if you know the muscles that actually flex the knee joint. If you don't know, you don't know. Okay? So, but if you know, you still need to reason out and arrange things. So the full question was like this. You observe that even though Brother Doe had a lesion of tibial part of the sciatic nerve, he still maintains some active flexion at the knee joint. How can you explain this anatomically? So first of all, you start by pointing out the muscle that the tibial part of the sciatic nerve supplies. They said, okay, this muscle is out. But we also have some other muscles that their nerve supply is intact. So this muscle will still be flexing the knee. That's just how it is, okay? So let's quickly look at it. You see muscles that flex the knee, and you guys already know what flexion is, right? This is flexion. Okay, flex. Okay. We said that the tibial part of the sciatic nerve primarily innervate muscles of the lower leg. You are building up something, which include gastrocnemius and soleus, which are responsible for ankle plantar flexion. That's a point. However, it also provides some innervation to the popliteus muscle, which assists in knee flexion. So it also supplies just this tiny muscle here. All right. So we also have some other muscles that help in flexing the knee and all that. Okay. So this popliteus muscle assists in knee flexion too, but there will still be knee flexion because there's preservation of the common peroneal branch of the sciatic nerve, which innervates the biceps femoris muscle. This muscle is involved in knee flexion. Biceps femoris. Why do you know that the common peroneal branch is preserved? This is because they were specific. They said the tibial part. So the common peroneal part was preserved. So they're actually testing your knowledge of the lower limb for real. Okay. Then also innervation of the semitendinosus and semimembranosus muscles by the medial, that's the tibial, and the lateral, that's okay. Okay, okay, okay. So if semitendinosus is supplied by the tibial branch, that means semitendinosus is out. Sorry, I didn't edit this. Semitendinosus and the popliteus, they are both supplied by the tibial branch, so they are out. But the semimembranosus muscle will still be there because it is supplied by the common peroneal branch of the sciatic nerve. And the common peroneal branch was not affected. Okay, so this is what you can see. This is the common peroneal branch. Okay, was not affected. So that means the semimembranosus is still there, but the semitendinosus is out because it is still supplied by the tibial branch of the sciatic nerve. Okay, they're going to the third to the last one. We said that there's also some compensatory actions by the sartorius and gracilis muscles, which are innervated by the femoral nerve, and this can assist in knee flexion too. There's also preservation of the L2 to L3 spinal segment or roots. These ones too, they contribute to knee flexion, through their innervations of they innervate the quadriceps and the hamstring muscles. Okay, so those are the things that are affected as a result of lesion of the tibial part of sciatic nerve. Then some other things are preserved because their nerve supply is not affected. So that's just how you build up your points and you'll be able to actually answer this question. So that's it.